Today, we're gonna talk about enhancing intimacy. So we're gonna talk about different solutions for common sexual health concerns for women and men. Hi guys, my name is Martyna Erskine. I'm a nurse practitioner, board certified and functional medicine provider. I work at Joy Wellness Partners for last 6 years here, and Joy Wellness 7 years ago, and our team has been dedicated in advancing expertise in a sexual health since then. We help countless individuals enhance their overall well-being, and then from care like hormones, O shot and P shots. So sexual health is a very vital aspect in our life, influence not only our physical health, but also our mental and emotional well-being. That's why it's very, very important topic that is very often overlooked or misunderstood. And it plays such a crucial role in how we feel, how we connect with others, how we even experience life. So that's why today we will go deeper into importance of sexual health, exploring different issues that people have and how we can fix them with personalized functional medicine care. So let's start with erectile dysfunction. So what is erectile dysfunction? It's actually a very common condition that affects men worldwide, and particularly usually as they age, but not always. Recent days, it's becoming more and more common among younger guys. And it's defined basically as the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. And surprisingly, 30 million men in the United States suffer from erectile dysfunction. That's a lot of men. So I just want to really put huge emphasis about that it's not just erectile dysfunction that it's affecting our health, but usually goes hand in hand with physical health, with mental health, and social and economic impact of erectile dysfunction as well. That's why it's so important to address it to improve other aspects of your health. For example, physical health, cardiovascular risk. So erectile dysfunction usually goes hand in hand with cardiovascular conditions. It can be actually early sign of cardiovascular diseases. So erectile dysfunction very often starts with high blood pressure, for example, hypertension, diabetes, and atherosclerosis. And all those issues also lead to heart attacks. So, for example, men with diabetes are particularly prone to erectile dysfunction. More glucose you have in your blood, that glucose goes to tiny little vessels and destroys them. And that leads to heart attacks. Like most of the people that suffer from diabetes die from heart attacks. And also diabetes leads to erectile dysfunction the same way, destroys small little capillaries, small little vessels. And an erection is all about the blood flow. More blood flow to the area, the stronger the erection, the longer the erection. Also, if it comes to mental health, it's a huge psychological distress because men feel like they cannot perform in a bed. It causes a lot of anxiety and depression. It affects men's self-esteem, and it can lead to decrease in overall quality of life. When it comes to relationships, the same story. The inability to perform sexually can lead to relationship difficulties, create tension, and communication even barriers between partners. Surprisingly, have a social and economic impact. For example, workplace productivity. They did a study that men with erectile dysfunction experienced a decline in work productivity due to psychological stress and just distraction in general. So it costs a lot of money to treat erectile dysfunction with medication, implants, and all of that. So addressing all those things is important, and I will explain every single one approach we have to physical health and mental health if it comes to sexual health. So low sex drive, which is also called low libido, it's not as common for men. 15 to 16% of men suffer from low libido. It's usually hormone-related, testosterone. For women, it's more complicated. 30 to 40% of women suffer from low libido, and it's not as age-dependent like it's for men. So sex drive for women especially, it's multi-phase. So it means like there's a lot of reasons why women have low libido. It could be some physical factors like hormonal imbalances, for example. For men, testosterone play an important role in a high sex drive. For females, could be testosterone, could be estrogen, and also progesterone. Chronic illnesses, like I mentioned before, diabetes, heart disease, obesity, they all lead to low libido and they affect your energy levels. So less energy you have, less you think about having a sex. Medications, so antidepressants, which are very, very popular in America, they lead to low libido. They also lead to weight gain, and weight gain leads to low libido because it lowers your self-esteem. Another medication that can really lower your libido are birth control, which we put so many young girls on, and also sometimes menopausal women on birth control. And they basically suppress your progesterone and they suppress your estrogen, which then suppress your sexual drive and also can lead to weight gain, just like antidepressants. There are also psychological factors that affect our libido. Anxieties, especially, it's related to low sexual performance and body image issues. Depression, like I said, it's a major factor in low sex drive. And when people are depressed, they put on antidepressants, which they also can lead to additional, even lower sex drive. And relationship issue like lack of communication, not feeling safe in a relationship, some unresolved conflict, emotional disconnect can also lower sex drive, and other lifestyle factors like alcohol and substance abuse, especially opioids. So opioids really lower testosterone for men, which can lead to low libido, of course. And they also lower your libido indirectly and directly through testosterone and also by taking them. Alcohol the same, even though after like 2 glasses of wine, people do feel like more sexual, the libido goes up. Chronic use of alcohol does opposite thing. Lack of course, exercising, bad diet, eating processed food, weight gain, that all can be libido as well. Perfect. And then, of course, things that we don't really have too much impact on, like aging. Like we cannot do anything about, except that with aging, we often have decline of hormones, and we can correct hormones, and that's how we can correct the libido issue and sexual performance issue. Women also, after menopause, don't really feel like having sex because of the decline of hormones. Also, the physical changes in the vagina itself. Lack of lubrication, dryness, all those things can lead to low sex drive and postpartum. So postpartum is pretty hard because for women, as they have a baby and they're pregnant, the baby is growing, the hormones are raising and raising until the last trimester. And after giving birth, all your hormones leave your body just like the baby leaves your body. So you end up with like no testosterone, no progesterone, no estrogen right after giving birth. Plus, not to even mention all the physical trauma to your reproductive organs and all of that. It really takes a long time for women to recover from pregnancy and giving birth, get the hormones back, and then get the libido back. I also want to mention vaping because today I saw a man this morning on a beach vape, and vaping is extremely bad for you for libido and your sex drive because first of all, vaping, it's like basically heating up plastic, with some oils. So plastic, what it is, it's xenoestrogen. So it increases your estrogens and really decreases your testosterone. Also, nicotine in it, it's a vasoconstrictor. So vasoconstrictors usually less blood flow, less sex drive, less sensitivity, and all of that. So vaping is probably one of the worst thing you can do. It's even worse than cigarettes, just because of that component of xenoestrogens, bad oils mixed together, nicotine as a vasoconstrictor, and also it's very, very inflammatory. So those are like a lifestyle factors that we can totally avoid by just changing our life. Also, other things that can decrease women's libido and leads to lack of organs. So, of course, menstrual cycle. So, there is 28 version of woman, and she's a little bit different person every day of the cycle, depends of her hormones. So, right after period, hormones start rising. So, usually, women tend to feel a little bit more sexual during ovulation, which is the time when we are the most fertile. That's when we have the highest level of testosterone, the highest level of estrogen. That's when we really feel like having sex, and we have a lot of lubrication, and then a lot of sex drive. And then once the body knows that your egg was not fertilized, and it knows to start preparing your body for menstruation, that's when your body kind of gives up, like stop producing testosterone, your lubrication goes down, and more interestingly, your vagina actually becomes like shorter. So sex become more painful because of the dryness and because of the position of your uterus. So menstrual cycle definitely affects libido. Other thing, it's like the pain during intercourse. Some people have vaginosmus, which is basically involuntary muscle constriction in your vagina, which is very, very painful. Those women have to have like Botox injection to relax muscles to finally be able to have intercourse. Diabetes, like I said, sugar destroys small little vessels. Small little vessels, when they're destroyed, there's less blood flow, so there's less sensation to vagina, to clitoris, to penis. So diabetes always goes hand in hand with erectile dysfunction and sexual issues. Like not always, but most of the time. And thyroid disorders. So like low thyroid causes fatigue, low libido, also make you like gain weight easily, lose your hair. So all those things can also decrease your sex drive. And also we have to mention about like the complex anatomy for females. So have this kind of like expectation that they should have a G-spot orgasm, but it's actually more common for women to have clitoral orgasm, and they sometimes can never achieve the G-spot orgasm, or they don't have enough nerve endings there or sensation, which can be, of course, can be repaired via doing O-shot or shockwave. So penetrative sex alone sometimes might not be sufficient for that stimulation. There's also a lot of anxiety for both partners, and sometimes some even components like guilt or shame, depends on your culture or your religion, as sex can be seen as something shameful. Okay, so those are all the problems that people have. So now let's talk about solutions. So how can we address physical health? Because I talk a lot about mental health, physical health, lifestyle changes, which are more up to you, but we'll mention them. So physical health, number one thing that we can offer, it's a shockwave therapy. And shockwave, it's acoustic energy, which is the sound energy that when applied to your skin or your tissue, turns into kinetic energy. And what it does, it basically increases blood flow to the area and cause something called angiogenesis, which is formation of new blood vessels. So more blood vessels you have, then it's improved blood flow to the penis, to clitoris, to your vagina in general, and that promotes a release of growth factors. It's not something that you just like, Viagra, you take once and helps to increase blood flow to your penis just temporarily. This is actually a long-term treatment that can lead to long-term improvements. So it can address underlying vascular issue of erectile dysfunction. That's why this is physical health, because it works on your vascular health. Also promote regeneration of nerve tissue, which is very important to enhance sexual pleasure. The benefits of it, it's like non-invasive, so there's no needles involved in a shockwave therapy, very minimal side effects except gentle discomfort during the shockwave and long-term results. And there was a study they did a couple of studies they used shockwave for men after pineal implant, after pineal rehabilitation programs to basically regain the function post-surgery. And for women, they were using it after childbirth, that when they were experiencing some decrease in sexual function due to trauma. And it really, really helped to repair and restore function. What other things we can do to improve physical health of our genitals? It's PRP injections. So we do in the clinic, since we open P-shot for men, O-shot for women, they both similar procedure. You basically come to the clinic, we draw your blood to separate platelet-rich plasma from the rest of the blood components. And we give you a numbing cream to numb you topically. So then when the PRP is prepared, we start injecting it. For women, the injections are in the clitoris and then also in a G-spot all along the anterior, which is frontal wall of your vagina. So we definitely go in that muscle between your vagina and urethra to stimulate it. So not only helps with lubrication, not only helps with sensation, but also can strengthen the muscle for women that have incontinence when they cannot hold a pee after childbirth, after that trauma. For men, we inject basically on the dorsal top part of the penis, and then that increases the blood flow also because angiogenesis, which is formation of new blood vessels, and it can strengthen an erection and improve the erection. Some men even notice a change in size, mostly the thickening, not necessarily the lengthening of the penis. So, and of course, increase sensation for both partners. So what are the benefits? Enhanced sexual function, improved blood flow, quick recovery, even though it requires injections. We also inject numbing solutions before injecting PRP. So we numb your dorsal nerves, which are two nerves that run on top of the penis and also two nerves that run on both sides of clitoris. So we do numb them before doing PRP injections. And what are the other things that can increase the physical health of the sexual functions? So for men, like I said, erectile dysfunction usually goes hand in hand with cardiovascular diseases. So addressing cardiovascular health for men, it's a very, very important thing. So number one thing we put men on is Vascanox. So Vascanox can improve erectile dysfunction by increasing your nitric oxide. So it's like slow release nitric oxide supplement. You take it 1 or 2 a day and leads to more blood flow to all the parts in your body. It really relaxes your vessels, so helps with high blood pressure, with cardiovascular diseases, but also helps to bring more blood flow to your penis. And of course, more blood flow, the stronger and longer the erection. For men, we also offer Arteriosol. So Arteriosol is the supplement that can heal your vessel from the inside out. So inside your vessels, you have this inner layer called glycocalyx. And glycocalyx has this like a hairy, slippery substance on. That's the glycocalyx, like the hairy, slippery thing. So when the glycocalyx is intact, nothing can stick to your vessels. However, when there's some kind of damage to your glycocalyx from smoking, for example, chemical damage, from high blood pressure, which is physical damage, toxins, then anything can stick to it, like cholesterol or other molecules. So improving glycocalyx health can improve your whole vessels and heart health, which can then improve your erection. So Arterisol is basically like green algae extract. It's I think it's green algae or red algae that was designed by a bunch of cardiologists, and that's the only thing that repairs your vessels. Because a lot of people go on hypertension medication, for high blood pressure, and what it does is just basically relaxes your vessels temporarily. Arteriosol actually heal your vessels from inside out. So that's the only thing like right now on the market that kind of like heal vessels, which we cannot use word heal or treat, but yeah, they have a bunch of study. You can take a look at them on the efficacy of Arteriosol. It's pretty impressive. And then, so physical health for women now. So we have a special formula for a woman. It's called Scream Cream. And cream is basically compounded cream that is done by compounding pharmacies. We have 3 different versions of it. Depends of like what's the main issue for women. We can suggest one on another, but basically they have L-arginine, they have some oxytocin sometimes in it, some sildenafil that it's also like basically a Viagra to causes vasodilation. So there's more blood flow to clitoris. You apply it basically like 30 minutes before sex. So increases your sensitivity because there's like more blood flow, and L-arginine to increase sensitivity and improve the blood flow, and can also enhance lubrication because have some like a lubricants in it as well. So really cool formula. A lot of women are trying and they love it. So if you are interested, we also have it in our package that we'll talk about it in the end. And also special formula for women, it's PT141. It's a peptide, injectable peptide that you also inject 30 minutes before sex. And that one works on physical health, but also on mental health. Really works on your melanocortin receptors in your brain. which gives you this kind of sexual motivation. So you feel more like higher libido. Also increases blood flow, the same like a screen cream, so then more sensation, more arousal over there. It can enhance your orgasm, apparently. Some women said that they have more intense orgasms after injecting PT141. Yeah, and of course libido. So this is like how we address mental and physical health for women. And now physical health for men and women, very, very important, especially for aging women and men after menopause when all the hormones decline. Number one thing we want to do, we want to replace the hormones. So for men, of course, we boost testosterone level. And testosterone does everything, like increase your libido, your sexual desire, your performance. You gain muscle easier, so you feel better about yourself. So that can enhance your moods. Also enhances your energy. It's very motivational hormone, works on the dopamine receptors in your brain and really makes you want to run extra mile, makes you want to do extra things. So very, very motivational for men, for physical and mental health for men. I should probably put it that this is physical and mental health for both partners. Women, all the hormones play an important part in a sex drive and a sexual performance. Estrogen, for example, helps with vaginal dryness and discomfort, can enhance sexual pleasure. When we have high estrogen, when we ovulate, and high testosterone, this is when we feel the most sexual. So that's why we need to increase both of them. Also libido. Libido usually goes hand in hand with testosterone or DHEA. It depends which hormone it's, most of the women have low testosterone by the age of 30, and DHEA is the second one that slowly declines. So we start with replacing testosterone, estrogen. Also, hormone replacement therapy can improve your mood and energy, the same like for men, and enhance blood flow. Estrogen especially can improve blood flow to the genital area, which can then enhance arousal and sexual function. So where the mental health, like you see, I focus more on physical health for men, because really for men, it's more physical to have erectile dysfunction. It's the blood flow, it's the cardiovascular issue, it's the diabetes. For women, sexual functions usually more due to mental health, because for men, it's more like the settings, oxytocin, which is binding molecules, all those things play important roles. So focusing on mental health for women, that's number one thing. So replacing hormones, which can help with physical health. And then there's some supplements like Libido Stim F. It's a supplement that have a bunch of different herbs that will naturally increase your testosterone, but also will improve your energy, can boost your mood, and increase sexual desires, has so many cool ingredients in it that can help with so many different things. So this is one of my favorite. For those women that have a low libido, but they have a good mood. For women that have a depression and low mood, or sometimes they have really bad cycle, they feel mood swings, all of that, 5-HTP is better option. 5-HTP is precursor to serotonin, and serotonin is the happy neurotransmitter that we produce our body that makes us happy and motivated. And at night, it converts back to tryptophan, and tryptophan converts it back to melatonin. So that's why sleep and depression go hand in hand. If you sleep well, you're less depressed. If your sleep was compromised, then you have more chances to be depressed. So 5-HTP is precursor to the serotonin, happy neurotransmitter. You take it daily and you feel so much better. Someone take it from day 15 to 28. That's the time when they usually have the PMS symptoms, and that's when they take it to kind of feel better, So those are the supplements for women that we have in our package. So now we're going to talk about treatment options. So those are the treatments that I really recommend for sexual health. And now we'll talk about the bundles for men and bundles for women. Number one, executive bundle. That's the most Cadillac treatment for men. Total value of that one is $7,850, and we have it on discounts for 30% off. So that one involves everything we can do for your erection and sexual performance. That bundle has everything. So first of all, has a P-shot. So you come over to the clinic, we do one P-shot, which is PRP injection in your penis to help with grow more blood vessels, help with this physical aspect of erection. Includes 6 shockwave sessions, because to help with erection, you have to do minimum of 6 treatments. Includes also 2 tune-ups, which you want to do a year later. And includes all the cardiovascular supplements like Arterisol, 2 a day, Vascanox, to increase nitric oxide, and also monthly B12 shots. So this is a cardiac treatment. Everything we discuss, it's in it. Then the second package is called Elite Bundle. I call it a no needle bundle because that one does not involve any needles for people that are really scared of that P shot. Includes 6 shockwave sessions. So you have to come like once a week for shockwave therapy. Then a year later, you have 2 tune-ups, like a maintenance session to sustain your progress. Includes Vasconov supplement to increase nitric oxide, and also includes 2 arterial supplements a day to basically heal your vessels from inside out. The package is normally $5,900. We have it for $4,448, so it's 25% off. So the other one was 30% off. This one is 25% off. Then the next package, it's called Elevated Bundle. That one includes 1 P shot. So you come over for a P shot. We probably will do shockwave right before, and then you come back for 6 shockwave after, and then you have 2 tune-ups a year later. This package is really good for people that don't have necessarily any cardiovascular diseases. So they don't have like high blood pressure, they don't have diabetes, they don't feel like there's something going on inside like their vessels. So this is just working directly on a penis to increase blood flow over there and cause angiogenesis, new blood vessel formation. So total value of that package is $55, and we have a bundle price for $42.50. So it's 23% off on that bundle for men. And lastly, Essential Bundle. That bundle is really convenient because if you come over, all those things can be done in one appointment. So this is for very, very busy people. Just want to come over to the clinic once. They don't have time to come back for shockwave once a week and have it done because it's just like too much, with their schedule. It's also a really, really good bundle. You come over, you have your P shot done and shockwave right before the P shot. We give you a bunch of Vasconox, enough for a whole year. We give you enough arterial, enough for a whole year. And then you go with that. Then you take those supplements, and then we can reevaluate later and see how is your progress going. And total value of this one is $41.50, and we have it for $3,300. So it's 20% off our Essential Bundle. So this is nice summary. You guys should do you do the screenshot of it. I work hard on it to have it nicely, visually put together. So like you see, executive bundle has everything: P shot, 6 shockwave, Vasconox, all the supplements, and also tune-up. Elite, that's the one I call it no needle bundle. That one has mostly shockwave, 6 shockwave sessions, and a bunch of supplements to help with the blood flow and tune-ups. Elevate Bundle, that's the one that has P shot and 6 shockwaves, no supplements included for people that don't think the cardiovascular issues go hand in hand with erectile dysfunction. And they just want to improve physical aspect of erection. And then bundle is the one that you come over to the clinic and everything is done in one appointment and you don't have to come back weekly for additional appointments. And then we're going to talk about treatments option for women. And for women, like I mentioned before, sex drive and sex performance, it's more intertwined with mental health, but also physical aspect of that too. So this one, we have the same like for men, executive bundle that includes basically everything. So you have the O shot, so you come over, we draw your blood, we separate PRP from the rest of the blood components, and we inject it in your clitoris and also all along your G-spot and anterior wall of your vagina. You come over once a week for shockwave session, and then there's a couple options because women are so much more complicated. I put so there's a couple options here. So first, you can choose Scream Cream, PT141, or Oxytocin. So Scream Cream, like I mentioned, increases lubrication, brings more blood flow, more sensation to your clitoris. So you basically put it like on the top of your vagina on your clitoris. PT141, that's the peptide you also inject 3 minutes before your sex. And you also increases your desires, can enhance the orgasm, and brings more blood flow. So they're kind of similar. One is injectable, one is just the cream you put on the top. So maybe it depends like what sounds more appealing to you. If you want to inject yourself, be like, wait a minute, I need to inject myself. Let's have a sex in 30 minutes. So it's kind of less discreet. Scream could be like more discreet. And oxytocin, it's a nasal spray. So oxytocin is like a bonding molecule. It's like a mother of all the hormones. If you don't have enough oxytocin in our body, we feel very depressed. We feel very down. We don't feel like we love ourselves. So for women, oxytocin levels go hand in hand with sexual desires. So that's something you can have as a nasal spray. You spray yourself like once a day just to feel better, or like 30 minutes before sex, or an encounter stays in your system, makes you feel better. The fun fact about oxytocin is they were giving oxytocin to men before deployments, and the guys that receive oxytocin, they were less likely to cheat on their spouses. So it's really like I don't know how to call it, but like a loving bonding molecule. It works even after you're away from your partner. And then for women, there's also option libido stim F, if mostly she wants to increase testosterone and desire and libido and mood, but doesn't have so much of the depression, or 5-HTP for women that are really down, depressed, have a lot of mood swings. So it's based on the consultation. So we'll talk to you and see which supplement might be better for you. Also includes monthly B12 shots and 2 shockwave tune-ups a year later after this shockwave session. So very similar bundle to the men bundle, but there's just more option to choose from. Depends on the consultation. Oh, and I was supposed to mention that one total value is $51.80, and we have it also 30% off, so it's $3,600 in September. So all those sexual wellness packages are for September. Elite bundle, the same as for men. I call it no needle bundle. I even draw like no needle here. So that one includes shockwave for women that are really terrified to have a needle down there. Just to let you know, from the person that does O shots all the time, for my patients, I never received one, but I'm always surprised how well my patients take O shot. Like they really don't find it as painful. Maybe it's the cream that we use, maybe the numbing shot of the dorsal nerves, but women just say it's more like a little stinging or just a little bit irritating. I've never seen women having like really bad pain, like reaction to it. So that's really encouraging for me, knowing that, it's not as painful as you could imagine. And then, shockwave is included. So you have to come once a week for 6 weeks. Then you have a choice of screen cream, that PT141 peptide, or oxytocin nasal spray, and that's also based on consultation, so we can see what's mostly an issue with you and with your sexual drive and how we can fix it. Then you have also 2 shockwave tune-ups a year later, and the same libido stim F or 5-HTP supplements, depends on the consult. And then we have this elevate bundle, similar like for men. That one has a O shot, then shockwave. After that, you come once a week for shockwave, and you have 2 tune-ups. So that one doesn't include any supplements. So that's for women that really want to focus on physical health of her genitals, and she doesn't think she has any like mood swings. She doesn't think her hormones are imbalanced, and she doesn't feel like the libido is low. So it's mostly just to work on a blood flow there and increase angiogenesis. So that package, it's for $3,200, and we have a bundle price for $24.65, so it's 23% off. And similar essential bundles, very similar to the male essential bundle. That one, it's like one shop step of bundles. So you come over, we do your shockwave right before your O shot, then we do your O shot, and then you go home with 1 year's supply of screen cream, PT141 or oxytocin, and then 1 year's supply of libido stim F or 5-HTP. So it depends. And that bundle value is $31.60, and we will have it for $25.25, so 20% off. So this is like a nice summary. So I will suggest do the screenshot of that one too, so it's more visual, so you understand. Executive has everything. Elite has no needles, so it's mostly focusing on shockwave and supplements. Elevate has shockwave and O shots, so you can try everything, but you don't want to supplements because you think everything internally and mentally works perfect. You just want to increase sensation down there. And essential is what, like one appointment. You come in, you have O shot, you have shockwave, and you can go home with a bunch of supplies, supplements, and other things. So very similar package, female and males. We're trying to make them very equal. So that's the disclaimer. All those prices that I mentioned, it's like really nice discounts, 30% off, 25, 23, and 20, depends on the bundle. But that only works if you pay for the whole year. So you have to buy the whole package. And then all those tune-up and mantis sessions are for the next year. So the shockwave, the tune-up, like 2 shockwave sessions are for the next year. I talk about hormone replacement therapy. So hormone replacement therapy, it's like a separate bundle. It's not under sexual wellness bundle, but we do have a package for hormones, hormone membership. That's where we check your hormones. That's when we see where your testosterone, estrogen, DHEA are, and then we replace them accordingly. So DHEA is also in this libido stim F supplement for females. For men, there's also libido stim M supplement that has DHEA. However, we didn't include it in the package, but because we realized for men, they usually are already on testosterone, and testosterone really increases the sex drive and performance. And then they don't necessarily always need DHEA. Usually testosterone fixes everything for them, and it's mostly the issue with blood flow. So that's why we focus on Vascanox, arteriosil, and for women, it's more like mental, hormonal, and everything. So hormonal packages are separate from the sexual packages. They go hand in hand together. You want to replace your hormones and then work on the rest of it. Hormones we didn't fix everything. It's crazy because all those bundles are in September, like 30, 25, 20% off. But we also have a wellness week between September 16 to 20. And if you come on a wellness week or call us and pay for the package, you get additional 25% off. So some of the bundles can be 55% off. Some of them will be between 45 to 55% off. That's pretty awesome discount. It's almost like, it's half off, more than half off. So, but only during our wellness week. So come over and book it, so that you will have a really, really nice discount. So all the prices I mentioned will be additional 25. And then, everything will always start with a consult. So you will come over, you will book your first appointment. We will talk to you about what will be the best approach for you, and we'll go from there. So really, really awesome deal. And lastly, so I want to thank you all for joining me today. So it's supposed to be half an hour. I went a little bit longer. Thank you for joining. Really appreciate your time. If you are interested and you have an additional question, don't hesitate to call us or send us email or text us. Our email is info@joywellnesspartners.com. Our phone number is here, 858-609-0866. We're here to help you. If you need 15 minutes consult with one of the providers, we can schedule that for you. If you have specific, health questions. And don't forget about our wellness week between September 16 to 20, when you can get even bigger discount for all the bundles. So thank you so much, guys, and hope to see you soon in the clinic. Bye.
Thanks for watching. I'm Carol Joy Bender, the founder and nurse practitioner at Joy Wellness Partners. If you found this video helpful, give us a thumbs up. Please subscribe also to our channel and share this video with someone who you think could benefit from it. You can also learn more information about these services by clicking our link in the description below. You can also leave a comment to let us know what content you'd like us to put out next week. Thank you so much for being a part of our community, and stay along with us for enhancing wellness in our world. See you next week.